Hey, everybody. Thanks for checking out another episode of Tactical Scrubs. We are back in action. Today, I'm here with my lovely co host, Mr. Dean Malpass. And I'm also here with one of my favorite people that's just like making a fuss right now all over, Mr. David Boswell. One of the reasons I'm journeying to the UK, guys, I'm already in my sweatshirt. Like, I'm already layering up.
Welcome to Tactical Scrubs. Dive into the latest trends, practical tips, and expert interviews that help you excel in the healthcare world. If you find our content valuable, don't forget to like, subscribe, and hit the bell icon so you never miss an episode. As always, thank you for listening.
So I'm really excited to have David with us today. He's going to talk about his amazing, amazing innovation, Victor Care. And also, David, why don't we start with a little bit of like, how did you get started? Like, how did you kind of come up with the concept, like, I want to work in mental health transport?
Yeah, it's a good question. How long have you got? So by pure coincidence, when I first started out in my early 20s, in security, a real synergy there, by the way, in terms of kind of helping people and support people vulnerabilities. But we came across a medical company that was at events, and the event division was just one branch of a number, and we got on very well with them. They invited us down to their HQ, and when we went down there, it was actually over in Essex. I mean, this goes back a few years actually, so you have to excuse if my memory's a bit vague. But we went down there and we saw a fleet of these ambulances. They were a huge provider at the time, and there were some specific vehicles tucked away in a corner, all unmarked. But you could see that they had discrete blue lights fitted, all over them. And they took us over. They opened one of these vans, and it was quite obvious that it wasn't an ambulance. Had how I would have referred to back then a police cage, and it certainly looked like one. A dark interior, lots of files on it. And certainly from us, from a security background at the time, we were like, okay, well, this sounds really interesting. What is it? And they were like, well, this is our mental health division. We're like, right, okay, mental health. Well, why do you need, again, what we referred to back then as a cage? And they said, well, this is all part of kind of risk mitigation. If we're managing patients exhibiting violence, then they would tend to travel in this vehicle. Again, back then, when the company, when my security company, it was very seasonal because we focused on events. As I say, that's where we met this medical firm. And we were looking for, or certainly I was looking for, different revenue streams. They knew that we were, our work was seasonal. It was quiet in the winter. We were busy in the summer, so they were like, look, right, you seem really interested. We get on well. Why don't you come and work for us in your quieter months and kind of start to, learn about what mental health transport is all about.
So your background initially, though, was security. I think that's why you and I eventually like connected, was because I have a really like executive protection security approach to healthcare, because I think like you have a different perception of the asset. Like when I was talking to Dean earlier, we talked about just the approach that your innovation is different from policing type techniques and style. Is like your asset is the individual person. You serve that person in their environment around them. So I think like ultimately police kind of come in my understanding, in the US, and they're responsible for like the entire community and the scene, and they're kind of managing the person. And your approach is more, how do I support the person to manage a potentially dangerous environment? And I think that's the conversation that Dean and I always have about mental health nursing, is like they're not really, it's conceptual nursing. You're caring for the patient in crisis. You're not caring for, like me in an ICU. I walk in a room as an ITU nurse, and it's my environment, it's my room, it's my equipment to keep the patient alive. Well, in a mental health environment, the patient has to receive therapy, and it's their mind, it's their brain that they have to kind of help get themselves through. And I think that's why your approach is so innovative and so important. Tell like a little bit about maybe the challenges you saw either in the transport service or in the police departments or in the ambulance service crews that you kind of innovated to create Victor.
Yeah, sure. So going through that process of going through the training and looking at the vehicles, it didn't take long before we could see that, shortcuts were being made, training was inadequate. The vehicle itself, just in terms of their very design, the interiors, would be discouraging for patients, quite intimidating. And for me, that was the turning point. I knew that this was something that I'd fallen upon by pure chance, but had really grabbed my attention to be like, okay, there's a real purpose here. A service that we never knew existed, a service that's still in our sector. There's people that we talk to that still don't know it exists. You look at the Mental Health Code of Practice, you look at the Mental Health Act, and it's, there is no mention of kind of mental health ambulance transport related services in there. So obviously the doctors and all kinds of those fundamental important roles, but we are almost like a forgotten service, but it plays such a significant role in in the way patients are cared for. So identifying all those means, I was probably there for about 6 months, possibly up to a year, and I came away from that and used some of my own investment to look at purchasing a vehicle and looking at how I would set up a mental health transport service, and really that was the baby steps at the beginning, going by what we only knew then, but with a vision and aspiration of what I knew could be done to change for that. So, and that's where that's where the journey took place, and that's where Secure 24 was created. It's odd, when you look back to photos and you kind of look at what we were back then to what we are now. Excluding our journey with Victor, the difference is mind. In terms of kind of the innovations that we've used, just from we recognise there's risks, and when service users they exhibit violence, we need to put measures in place to be able to manage those for their safety and for the safety of staff and others. So coming and looking at how we referred to as what was a cage back then, we referred to that as a cell, a safe space, and the innovation we've gone through to be able to make it as, inclusion, for them to reduce anxiety, to be able to make sure that they feel secure as opposed to being criminalized. These are all massive factors that we've championed really through Secure 24. And, going through that journey of Secure 24, the concept of Victor, it's always been in the back of my mind. And the reason why we haven't been able to approach it until now is because of the amount of investment required to be able to develop, and to be able to identify the right SMEs along the way have been absolutely central to being able to get to the point.
Your reputation precedes you. So like when I started looking, because the whole reason that, for all of our listeners out there, whether you're clinical, security, policing, UK, US, the reason that David and I connected initially was because I really was looking for a concept that would meet the need of what I was hearing from police departments here in the US and abroad about just this, knowing that they didn't have the time or the advanced training to be able to really meet the need of these people. Like a lot of the officers feel bad. Like they're like, I don't know. Like I get there and I'm like trying to help this person and I can see that they're disorganized and they're panicked. And all I have is my police training in my pocket to help me make the scene safe. And that's what they should be focused on, not trying to, provide a psychologically or emotionally secure space. Maybe Dean, talk a little bit about why, you're involved in it, like why I pulled you into this whole mix was really because I knew that David had this like core concept. Jay speaks about it all the time. If she could bottle up David Boswell, it would be the caring and compassion and just the patient-centered approach that Secure 24 delivered that everybody raved about. And then I was like, I think it'd be great to have some really strong mental health resources and insights because he's got a commitment to excellence on the operations side. I mean, these guys are so well trained. So maybe talk a little bit about the patient involvement in this and why it's impactful.
Yeah, so fundamentally, you can't begin to think, in my opinion, about mental health care until you start thinking about human rights and the socio-cultural underpinning of people and sort of illness in society. I think mental health care, psychiatry, however we want to term it necessarily, our favorite phrase now, the exacerbated state of the human condition. So whatever we're talking about, you have to begin with people. So really, the great blessing of any mental health nursing approaches is that you are looking at a human rights-based approach if you're doing it properly. So central to all of that are these fundamental rights and obligations that we have in society. But then where we have massive risks and challenges, and how are we always finding that balance between what someone might need to get better, but whilst maintaining their autonomy and sovereignty as a citizen, and also minimizing and reducing the risk that they present to themselves or someone else. So it's a really fine balancing act. And I think many organizations and professionals that work in this sector and this space, it's a tightrope. Now in the UK, we are blessed, I'll say loosely, with layer upon layer of regulation and bureaucracy. Sometimes that's helpful, sometimes it's a hindrance. But providers and founders and visionaries like David have to really find a way to balance on that tightrope. And what attracts me to this stuff is that it's difficult. I always joke that I've made a career out of doing the stuff that no one else ever wanted to touch. David already alluded to that when he said, if it were easy, everyone else would be doing it. And I think that's quite right.
And I think there's something to be said for like anything innovative requires an initial investment. And I think it requires the initial investment from the right types of people. In order for something like Victor to be successful, it's going to take people who really do want to believe in the concept of public service and the environment of not only public safety, right? Like I was in downtown Austin yesterday, right? And we went by Joe Rogan's club because I'm a huge Joe Rogan fan. We went by and there was a couple of transient people on the street. And I had my children with me. We were going to get some donuts and they were really kind. And you know what? From Dean's training, the one guy who unfortunately was a above the knee amputee in a wheelchair, right? So he was just kind of hanging out, right? And he's like, I actually do security at Voodoo Donuts. And my kids were like, oh, did you hear that, Mom? He does security at Voodoo Donuts. I was like, oh yeah, great. That's cool. Let's go across the crosswalk, But I in that moment was able to explain to them what a true, delusion is from a psych concept, because he really believed that he did security at Voodoo Donuts. He was totally there. He was like, I wear a shirt and everything. I was like, okay. But I told the kids, well, maybe he did it before he lost his legs, Mom. You don't know. And I was like, but that identification of me knowing that he was no longer a threat, it took the fear out of it, because I now understood what he was saying and where he was mentally. And I was like, oh, okay, cool. He thinks he's doing security for Voodoo Donuts. So guess what? We're not going to get too close to him because he may think that he's providing perimeter security, and that may kind of initiate a response because he's going to kind of go with that concept because he's having an exacerbation of the human condition. So I think that's the difference between a Victor approach or a approach that's built by somebody like David and Dean and the difference between a police unit responding up. Now, we did talk about how police have to have an active role in this because of, legislation and statutes and all the things that are important. And we don't want to dismiss their expertise or their talent in dealing with these type of patients and community members. But I think there's a significant amount of operational time, right, that's being eaten up by the response just because, of the nature, right, David? Is that kind of what is being shown in the industry?
Yeah, absolutely. So I think, one of those reasons for me identifying a gap in terms of mental health care is where you've got police and ambulance services responding to incidents. Albeit, that I agree, there are some that their presence is required, their intervention, and they do a fantastic job, but they shouldn't necessarily be responding to the majority of these mental health incidents. But it's something that they've had to do, right? Because there has been no viable alternative. And as I say, that was the driver behind the design, of the Victor program. I suppose this would be the time where, you enter Victor, which is, as I say, it's a self-funded organization. And, one of the one of the advantages and one of the key, the key outcomes that we want to achieve from this is time back to the police, time back to the ambulance services where, they can refocus their resources, back to responding to, public policing and, out responding to that cardiac arrest or that RTC, as opposed to responding to somebody who may be in crisis, may not be in crisis, until you're actually there, you don't. So, as I say, that was a gap that I've seen for many years. It's a shame we couldn't get there any faster than we have done, but we're here now. We're really excited about it.
I think you guys are, you think you're right in a niche that, as I used to fly on a helicopter, right? So I know what it's like to drop down in somewhere where, we have an environment where, like, I'm coding a patient and there's active violence on the street. And literally, that patient's dead on arrival, right? There's no way they survive. But it's in my best interest to act like I'm doing CPR all the way to that helicopter till we lift off, because if somebody finds out that they're dead, it could be violent on me. I think that there is support in having experts that can help keep the scene safe, that can help triage, that can help, in an environment where you might want to flex your policing resources to that dangerous, life-threatening code, and then that mental health crisis call come in at the same time, and you've got that hour window or whatever to meet. It is a good supplement to know that you have the key word that you used, David, was a reliable alternative. And you have done your best through the training and the amount of, these guys have a physical fitness test, right? That they have to withhold and uphold.
Yeah, we do. So, if you think about it, the UK Police Service, their public order officers, they have to demonstrate a basic level of fitness. And, I suppose, one of the things to explain, so certainly for the listeners, people who may not be aware or they're wondering what VICTA is. So, that acronym stands for Violence Intervention and Crisis Threat Operational Response. And most people could probably gauge by that title, it's important, right? Talked a little bit about my time in Secure 24 and VICTA, and people probably wondering what the difference is, VICTA is a specialist service all about providing urgent and emergency responses to mental health related incidents, as opposed to Secure 24, and many of their counterparts, within the mental health sector, which focuses on non-emergency patient transport within the mental health sector. And because of the position of where we are in terms of the incidents that we would be responding to, it is absolutely key that the operators, who go through the level of training they do, have a criteria in terms of a fitness level so that they can demonstrate to their co-workers, but also other emergency services, that the activities that they're undertaking, the skills that they're taught in, they are well prepared to be able to move through those as required.
Can you talk a little bit, you two, Dean? Go ahead, Dean.
Yeah, I was just going to say one thing I wanted to build at, and defining the acronym was perfectly placed and helpful to do that. So one of the things, if we wanted to do this podcast for 5 hours and get me on my soapbox, we talk about how mental health is like the forgotten.
I don't have enough whiskey to do that, Dean.
Yeah,
I cannot drink enough. Like, it's only 10 a.m. here. Like, I can't for another 2 hours.
Yeah, don't worry. You're a well-funded ITU nurse, so you won't be able to understand what I'm going to say anyway. But what those of us that choose to work in this space have to understand is it's often violent, chaotic, complicated. You don't often have fixed outcomes. You can try your absolute best and end up with horrific outcomes. And it's really challenging. And it's so poorly invested in, I think I'll say, across the country compared to physical health conditions. That what I love about David's approach and the VICTA system and approach and model is that it adds a complementary specialism to existing services. So we don't think, David, I think it's probably fair to say, we don't have a silver bullet here to say cure schizophrenia. That's probably not something we've been working on, right? But what we can do is offer person-centered, professional, human rights-based approach to responding to really challenging, complex situations and sharing that responsibility with partners in key agencies. That's always important, because whenever there's progress anywhere in the mental health sector or marketplace, it's always in collaboration. So David's done a great job of explaining how this isn't a replacement type service or an and/or situation. This is about, we don't expect 9 times out of 10 that the consultant for orthopedics is doing, heart surgery on a regular basis. But in mental health care, there's a lot of oversight. So we've unfortunately expected police and ambulance services to just figure it out. And we don't do that with any other specialisms in the UK. So I think Victor is really well placed to add a much needed, credible, professional, supportive service to work alongside other key partners.
Talk a little bit about, like, if I'm a police commissioner listening to this right now, what, David, is your vision? And I say vision because I always ask people that are innovative on my podcast about vision, right? What is your real vision for Victor in the future? And then I'll tell you what I see in potential, and we'll go there.
Yeah, it's a good it's a good question. So if those if those professionals were listening, I think what would be key for us is we need people to come to the table, to come around, kind of open dialogue, have those communications. It's no secret that the police service believes that it should be able to take a step back. This is the responsibility of the NHS to manage these risks, posed, within healthcare, specifically mental health. And what we're offering, as I say, is a specialism, to steal Dean's phrase. But it's going to take a collective effort of people working together. So, who's going to fund this? For example, this is a service that requires funding. People would point to the NHS. There may be a collaborative effort, a joint approach where different budgets can be accessed to be able to support such a service. But I think the benefits that kind of come out of that is as I say, the time factor for police and ambulance staff. If you were to kind of add up all the statistics that are easily available outline, we're talking about hundreds of thousands of hours, even millions, I've read, of hours spent responding to mental health related calls. So if you were to kind of convert that into what that looks like as crimes responded to, distress calls within the public, lives saved, by ambulances being able to get to places because they're not engaged in responding to mental health related incidents, which, potentially and most likely probably don't actually need clinical intervention. Everyone can kind of work out that picture, right? People can see that picture right now. So, when you look at that, versus, you try and balance it, I suppose, or justify, costs of, what Victor Resources, how that would impact. I think it's a no-brainer, for these services to be able to come together and work with us and speak with us about, what we can do as a service, and how we can kind of much budget. So, it'd be a case of, look, this service has been developed. There's been a lot of investment, a lot of time, a lot of expertise behind this, and for good reason. And this is absolutely needed, and a lot of people believe in it. So it would be a case.
I love what the NHS does. Really, the NHS, your police department, your ambulance trust, what they do really well over in the UK that I wish America would do a little bit better is they're excellent at putting out like briefs and strategies and like their own targets. Like there's like written letters from the commissioners that they clearly have handwritten about like why they want to do the next things for the next 4 years. And as I'm kind of looking through and trying to figure out, for me, my trip to London and England is really about getting that knowledge and information from people like David, from people like Dean, and from resources and innovative commissioners like Katie, from, I think it was, where was it? Is that Sussex? I get all of my cities confused. I'm going to, hopefully once I get there and I drink in each pub, I'll be able to remember which
You're referring to the police and crime commissioner for Yeah.
she has like these whole initiatives where she puts out something like really innovative for the community and uses the extra budgeting. And like they literally, I think it was like only 150,000 pounds or something to run her whole office and operations. Like, and then the rest of it went to like really innovative community approaches. And she was really dedicated to picking an innovative solution and meeting the need for the public. And I think that's one of the benefits of having public funded things. But one of the things that makes what we do here at Tactical Scrubs and Cortex Gold really innovative is that I'm used to working in an environment where everything's about profit. So I'm really great at taking a concept like David Boswell's concept and Dean's advice and kind of figuring out strategically how operationally that's going to make us the most money or save the most revenue so that they can spend more money on different areas that need supplement. And I think one of the things that makes David's Victor approach really innovative is that not only does it meet like 5 of the metrics on these things like community engagement and outreach and better, resources and better perception of the police and how they operate and safety elements of the ambulance trusts, like keeping them physically safe is an important part of having operatives that are well trained to manage a potential violent event. Like, so all of the retainment. I mean, if I was an officer or an ambulance, say, let's say clinical, right? So if I was an ambulance paramedic or maybe even on a helicopter or road critical care transport or road whatever type of transport bus, and someone told me that I could pick up the phone and call Victor if I had a incident that just sort of escalated or I knew was going to escalate, and I probably know the majority of people in the community that have mental health illnesses because I've picked them up before, and I know how John, whoever's going to react. So I could be able to dispatch Victor and say, hey, David's really well-trained team that I know and trust, can you meet me here and let's do this together? That way, if I get a call in, I'm not leaving this person or their family or whoever in a lurch because now I'm the closest bus to go respond to a cardiac arrest. Like, I can kind of pick up my resources and know that this patient is going to be taken care of, because it's not always as easy as just taking the patient and putting them in the back of an ambulance and getting them to the local, place where you guys put your psych patients, because they're not ready for that. And the therapeutic window has to be open. And I think that's one of the pieces that we miss about, crisis response in mental health, is that an incident response is there's a certain way to care for that person, in the same way that I wouldn't expect a person in cardiac arrest to walk to the ambulance with me, like in the restaurant. Hey, buddy, I think you're having a heart attack. Let's get up and walk over to my ambulance. Like, no, I'm going to put him on a backboard, put the pads on him. Well, there's a certain way that you also respond to a person in a mental health crisis that I think you guys just get right. You just understand.
I think, not in the interest of shameless self-promotion, which I'm happy to do usually, but this actually isn't one of those occasions. In the book I write, talking about police and emergency responders in America, it's really a what do you call it, Mel, a field guide. There's a reason why it's make safe, make sense, make right in that order. So when I think about Victor, and the clue's in the name, when I think about Victor, the main spirit of their functioning, predominantly in that make safe area, that, and there's no point trying to back your way into making something safe after you've tried to make it make sense. The safety has to come first, and I think what you often see, I'm one of these people that I probably spend too much time watching incidents that don't go too well and reviewing them. I often get asked to do it. This is not something I usually do, just for fun, but there's often common themes. There's lots of things you can, and there's usually missed opportunities. And it's often because someone hasn't known what to do. Well, when you've got a service like David's team at Victor, you can actually make something safe, because that's the art, that's the noble art of your profession, because that's the thing you're primarily concerned with. And I think that's the real strength here. It's a great addition to what we have available I'll say in England, because healthcare is devolved, as I often say. So in England, this is a great offering to support and enhance what people are going to receive in quite a turbulent situation. You know, the clue's in the name: violence and crisis. We're not, you know, we aren't going to be suggesting in any way that the Victor team would be dispatched to someone that is just a bit worried. We have other pathways, other groups of professionals that deal with that. You know, we think about Victor and the spirit of Victor. We're talking about people that are professionals in violence intervention and crisis threat. And we just don't really have that anywhere else, David. I can't think of anywhere else in England today that specialises in such a, in demand, unfortunately. You know, Metropolitan Police, 78,000 mental health related calls in emergency last year, 208,000 welfare calls last year. That's just one police force, Mel. You know, that we have. So for David's team to have had the foresight and the dedication, because David, no one's forced you into doing this, right? You've done this purely. I'd be like, well, it doesn't feel like that, Dean, most days. But this isn't something you've been told to do long ago by someone. It's like you've done this because you think you can make a positive difference to the experienced people through that. And I think that's highly commendable. And
he's bootstrapped. It's not like he even went to somebody and was like, oh, let me get some VC funding and put into this and then build it. He was like, no, I literally am going to do this because I know that there are people that I know personally, the other ambulance, you know, folks that ride on these buses or officers that he's worked with that could use my support and have a safety approach. And like I was saying before, if I was a nurse or a paramedic or an EMT, I don't know what you call them over there, but riding on a bus, I would prefer to choose an ambulance service that had something like Victor for me to pick up the phone and call, especially if I'm new. They have a ton of these recruitment programs going on over there, which are awesome. You know, here we have a really strong culture in rural communities of local kids from the high school joining the fire department. And a lot of our firefighters are also EMTs, also paramedics, and a lot of them become police officers. And they're interchangeable. So it's a different environment. From what I understand over there, it's kind of more, maybe a more siloed approach. And if anybody listening to this wants to reach out and have a chat over coffee or tea in England about how you guys interact with each other, I would love to hear more about it.
Please, if you know, Commissioner, you know, Katie Bourne, OBE, if she is listening, please, Katie, a personal plea to you, please contact Mel. You know, she's absolutely, you know, I think you've become something of a personal hero. Please.
She's so cool. We never have like women commissioners or women like sheriffs over here. Like, we don't have that woman approach to like, and it's so neat to see how she operationalizes workforce and then still really cares about their well-being and also the well-being of the community. And to me, that is how policing is done. And I think they're the type of people that will work well with the Victor initiative, because not only do we need, you know, for me, long-term vision, right, David? I told you, if you showed me yours, I'll show you mine, right? I think that Victor will become commonplace for the entire country over there. And I certainly think it'll be statewide implemented program in the US for sure, 1000%, because over here things are just a little bit more cowboyed up, right? We're a little bit crazier, but there it would be really nice to be able to get some metrics, get the data that we're looking for, get the proof that there is a place for this that not only helps with retention, helps with recruitment, helps with operational time, helps with safety, and then going back to the patient experience and the way the patient's family now feels about emergency services. How great is that? If you're a mom of a kid who's having a psychotic break, right? This is maybe their first time that they've ever had this, and you call 911 because your kid is in a crisis and you don't know what to do. I can just imagine as a mother, like, and calling and having somebody like Victor show up that's kind, compassionate, you know, can, in conjunction with the police if it needs to happen, but the officer stays in their realm. The officer can say, hey, look, he's in really great hands right now. I'm going to return to the vehicle, start my report, whatever I need to do in order to move this process along, and getting him the appropriate help. while the Victor operatives are trained to really provide that safe, secure space. Right, David? I mean, I
Yeah,
think that's
yeah,
the approach.
yeah. Couldn't agree more. One of the things I just wanted to touch on again, kind of reverting back to kind of benefits and impact, is I was having a conversation, not so long ago. We've talked about time, right? We've talked about kind of police. We've talked about the ambulance staff, out there on the trucks. But one of the, so it's a kind of very, very much kind of community based. One of the things also is like the EDs, the secure facilities, those kind of secure, the Victor program or the Victor concept, allows preventative measures. And kind of, what I mean by that to add context is, if you have an incident that takes place on a ward, wherever it may be, it takes for the incident to happen to be able to be the trigger, 9 times out of 10 to then call the police, to have a police response. So whilst that incident is taking place, they've still got to wait for a police response, to turn up, assuming there is a police response, available quickly, because of, we could be talking, 2 a.m., on Saturday morning after a fire, right? In London, and things are all going a bit crazy. But with a Victor, with organisations, whether it's a single NHS trust, whether it's a collaborative approach with different NHS trusts, or private organisations, whatever the case may be, for the staff knowing that they have access to be able to pick up the phone and call a Victor as a preventative measure, because they anticipate that an incident, is going to unfold, and the outcome for that is someone's going to get hurt, right? They don't need to worry about getting the black mark or taking police officers away from being able to respond to that crime or that domestic
And if
violence.
we look about like A&E, just to speak in the A&E environment, because I think like a lot of times people are like, oh, well, we're focusing a lot on pre-hospital, we're focusing a lot on emergency services and police. But like as an A&E nurse, 2 a.m. London, the soccer team, local soccer team wins or loses, right? Maybe there's, some dissonance there, or football. Sorry, I said soccer, but you know what I meant. And you've got somebody that's just really challenging to manage. They're, they've had a little bit of alcohol, maybe they're in an environment where they are unfortunately quite difficult to receive care. The ability as an A&E nurse to be able to say, I know somebody, and to also in team dynamics, right? I talk about operationalizing workplace violence. That's what I like, prevention, right? How do we prevent these incidents from happening? Because I'm not focused on end stage legislation and all the crap that people want to put their effort towards. I want to prevent my colleague from getting punched in the face by drunk Joe, right? So I think there's an opportunity for, even in the algorithm of training elements, Victor has this phenomenal demo team, which I'm really excited about being able to come see and work with and then show at this emergency services show. So we could talk a little bit about that. But that demo team of highly trained folks is available also to come around and, help supplement your A&E environment. So you can say, I want to do a little bit of training. If we get to the point where we're at a category 3 or whatever your tier system is there, right? So we can call Victor, because the Victor guys will come and be able to be with, or gals will be able to come in and help us create a safe environment so that we can provide care, because unfortunately we only have X amount of people here tonight and I just don't know what to do. And I'm an inexperienced A&E charge or A&E supervisor, even house supervisor, and you've got multiple violent incidents. I've been a supervisor on a shift where I have 4 different psych patients in different areas of the hospital at the same time, and it's a full moon, y'all. And it is just crazy. And I would have killed to have somebody that I could call and say, hey, can you just come and help manage and help provide a safe environment so we can get this person either, in a stable situation where they can receive treatment ultimately. Because like that drunk guy really needs a banana bag and he probably needs to just sleep it off, right? Well, that might be difficult to communicate to him while I'm busy and worrying about the code down the hallway. Like I may not just have the bandwidth to deliver that service that that patient needs. And ultimately, my understanding of the NHS and the way that you guys aim to deliver care is that you meet the needs of the patient. Here
Yeah.
in the US, unfortunately, we meet the needs of the dollar sign, so it's a little bit different. But that's why I'm encouraged to be able to see this demo team and to see what you guys, have to offer and to show, because it's going to be really impactful for multiple environments, even like a pediatric care home where, you've got somebody that may have been unfortunately having a crisis, but that's their home. And if we can try and manage it and keep them in their environment, it's often better for them, right? I mean, that's my understanding. I could be wrong.
And that kind of that looks like over time, is significant improvements in workplace safety for nurses, a reduction in injuries for assaults on nursing staff and other healthcare professionals, which in turn would increase attendance, rates, and increase, staff retention, and probably do something to kickstart, recruitment, and knowing that actually, as opposed to going into, high risk situations, through the line of work that they do, and as I said, there's risk in everything. Knowing they're going into a career where, there are measures and solutions in place to keep people safe.
I think it's worth saying it's not that I couldn't handle. I'm from West Baltimore. I can handle some people, let me tell you, but it might not be the therapeutic approach that person needs to initiate treatment.
No.
Like, I might be
I
like,
have it said now. I feel like I should step in and defend your own honor. And now, won't hear it, David. I don't know about you, but I think Mel would do an absolute splendid job from West Baltimore.
I'll be like, you want to go? Let's go. Like, let's test.
Proving the case once and for all that Victor is a timely innovation into the marketplace. Please, let's keep Mel away from the people that she shouldn't be around, and let's have David and his team do it expertly and professionally and safely. So I think, Mel, you inadvertently you've become...
Well, I have a gift for you today, David Boswell. Dun, dun, dun. Look at this. You didn't even...
There we go. We haven't done gifts before.
Ooh, watch out. Who knows? It might be a Texas Scorpion. No, I am going to gift all of your Victor operatives tax training. So...
Oh, amazing.
And that's the first training to be selected for research by the Institute of Homeland Security here in the United States. And so I am going to give you my tax training so that your operatives will be prepared and ready to drop into an A&E, drop into an ICU, drop into any clinical environment and really understand the legal, ethical, all those implications of what that really will look like. And I know you guys have done an excellent job with your training because I've seen your training suite. So nothing that would really change the game essentially, but I would love to be able to just give that resource to you guys because there is some things that security, policing don't understand about an inpatient health environment. And that's really what TACT is designed to do, is to cross that bridge between the two. And I'm excited. We'll have to get me to do the physical fitness test. Wait, what do I have to practice? What do I have to do? Like, what is the physical fitness test? Can I do it?
Yes, I think you'll be able to do it. I think you time box, right? Is that right?
Yeah, but I throw up every session. So it's not, you should see my trainer. My trainer is like, I don't even know her. In group class, he's like, I've never met you before in my life. So what do I have to do? Is it like a run? Is there like ammo, like lifts? Like what do I do?
Yeah. So well, there's a few elements of the fitness assessment. So there is a shuttle run. It's the 6.3 over a 15-meter shuttle run.
How far is it?
You've got a drag, what they call the roof drag, which a lot of firefighters use, in terms of their physical training. So it's a 55 kilo dummy.
That's because let's talk about something slightly unpleasant, but you might have to be able to like actually lift someone's body weight, right? Like in an event where they've unfortunately attempted to like take their life, or I imagine like actually maybe having to lift a patient or lift some degree of their body weight, especially if they decide to, when people are kind of struggling, they go rigid and they kind of, I'd imagine you have to have some degree of like physical strength to pick someone up, correct?
I think there's all sorts of so many different scenarios there where you could find yourself potentially needing to, deliver some sort of intervention where you need to pull somebody, whether that's to safety, whether that's to move them out of the way of something, whether that's to stop them trying to, escape, from you for whatever reason. And it's just another element that physical fitness. It's difficult. So that's a pull wave of over 30 meters. And this is consistent, right? So you do your bleep test and you go straight into the into the dummy pool. Straight into strength tests through press ups, grip tests, into plank hold. I think that's about it. So you can take a breath. So there's a variety of ones there, all kind of focusing on different areas of strengths, with the body, from the floor, to stamina, to legs. There's all these types of things. And as I say, these are all, these haven't been reinvented. These are out there, right? These are things that other organisations, proven, tested, that we've just adopted because we recognise that actually, in terms of our skill level and the probable scenarios we'll be involved in, if they're doing it, we've got to be able to do it.
Yeah, I think that's that successful, reliable handshake, right? Like, if I'm going to shake your hand that you're going to assume care or responsibility for this scene and I'm comfortable to eventually leave, then I need to know that you're capable of handling it in the same way that I could. But also, like, there is an amount of stress that we can simulate physically, right? So when we're running, when we're active, when we're, moving, you have a physiological response. Epinephrine is dumped, cortisol levels are high because your body needs that, right? So in that element, we want to be able to simulate mid-run, mid-lift. Okay, now you have to turn around and talk very calmly, compassionately, therapeutically to a patient who's maybe in a terrifying environment that's probably quite terrifying for you to visualize as well. So there's a degree of emotional regulation and breath work and things that can help in this situation from a tact perspective. I see that. I don't know if that's a stretch, but
I think we need this as content, Mel. I think you passing the annual fitness test for Victor, the audience deserve, nay, demand it. I think you would be doing us all a disservice if that wasn't some high quality content.
Maybe
watch it.
Yeah, I think
I'll make sure I bring you some popcorn, David. Jeez, I'm gonna be over here like throwing up in the corner, and he's gonna be like, "What fat?" No.
Well, in fairness, Mel, then David, correct me if I'm
fat ass, David. And Dean, you can either a fat ass or a badass. That's what my BTS says. Okay, so
we're just supporting you because you said, David, correct me if I've been uncharitable here. Mel said she wanted to come over and learn. Well,
I can do 7 pull-ups. Does that count?
Not on the list. I'll send you. I have all the training requirements. David and his team have been very kind of sending it. I'll send it to you, and then I think we see what happens.
Well, it's 106 degrees Fahrenheit today, and I ran the hills this morning, so I might.
It's never been that here ever, so don't worry about it. I think the most we've ever been is 105. See, you'll be fine. Pencil her in, David. I think we've got a firm commitment to this, and I'll make sure that we've got.
What other kind of training do you cover? We've got a couple minutes left, I think, before people really get sick of hearing me run my mouth. But so, what other kind of training is impactful for your operatives?
Yeah, so good question. So we have a number of different SMEs that take part in the training. So we've got a head trainer who kind of coordinates it all. He's an expert in violent person incidents, physical interventions, behavioural awareness, being able to manage those, as well as obviously a key focus around de-escalation. And then we've got threat-free, first response, threat-free, first response. I can't remember the last one, but people will know what I'm talking about. So the name's gone from my head. It's a much more advanced level of medical intervention as a first responder, which is really.
Oh yeah, okay. I think Jay mentioned that to me. It's like where you learn like certain things like hemorrhage response and like things like that are in addition to just basic first aid.
Yeah. So you've got airway management, you've got oxygen management there, so there's a few different things as well as being able to kind of, look.
So like an overdose, if somebody were to overdose or something, you could at least put in a little bit of an airway till, we can get help. That's really impactful, actually. Like that's amazing. That'll save so many lives. This is going to save so many lives. Like it's going to save people in their careers. It's going to save people from leaving the professions. It's going to save people's lives. It's going to save public image. Like I'm jazzed about it, guys.
So I think the key one, there are others, but with those that I've just mentioned, but also the crisis intervention that we have, which is a bespoke force. Nothing exists out there. That you've got negotiation forces which exist for the police. I think they're about a 2-week force. That level of funding to be able to kind of go into those extremities. But what we have been able to do through an expert, in his field with crisis negotiation and kind of hostage negotiation, is there is a methodology to how in crisis, and and how you communicate with them, and kind of what that content person does, as well as the safety person and the admin person. So we train in that. We go through the heavy parts, all of these, are linked in with scenario-based training. So bringing all the elements together. So they're the key ones. You've got crisis intervention, which is far and beyond what standard police officers would get. And in fact, I don't believe they get any. So when we're turning up to scene, if the police were there, it may be that whilst we would fall into a supportive role to the police, then they understand and they recognise the skills that Victor operators have. It may be if we're at a scene where somebody is in crisis, they ask us to take the lead in terms of that level of communication to try and bring that person down. Where we can
you're secure. You're there for the patient. You're there for the patient. That's the difference. You're really there to provide a safe scene for the patient, and byproduct police. But when we look at the core concept of Victor Care, is you are operatives that are well trained to meet the need of whatever crisis that a person is having, whether it's low level crisis to high level crisis, as long as it's within that critical time frame of response. And that's so powerful. And I just, on behalf of pre-hospital, people everywhere, and A&E nurses everywhere, just thank you for really stepping up and taking your own money, your own time, your own energy to help us. We are really doing the best that we can. We're doing the best that we can. And it's going to take people like you that are innovative and motivated to stand up. And not only that, but you're comping these experts on their time to come in and help develop and just make sure that your team is as well prepared as they can be. I mean, I know you guys have even talked about the psychological impact that this may have on your teams and how to prepare them for that. And I just think you're just such a forward-thinking innovator and somebody that's going to go far in this space. And I really am honored to kind of be over there learning and be part of this experience with you. And I hope that people listening to this are empowered to step in and make a difference where you can.
Yeah, no, I really appreciate that feedback, and I think one of the most rewarding things to date for me, in terms of the, what means the most is it's the belief of people, of not just the staff that are here with Victor, but who believe in what they're doing. But it's the experts and the professionals that we talk to, police officers, ambulance staff, healthcare assistants on wards, firefighters, whoever it is that we've come across and we've spoken to about the concept of Victor, about the launch taking place next month at the Emergency Services Show. They all say this has been needed for a long time, and this service, should go far. It's absolutely needed in terms of, as you say, that specialism, to really take the lead in terms of bringing everybody together in that collaboration between all emergency services. So, the only thing that's going to top is when we see this, live, actually making a difference, right, and saving people and keeping people safe.
On that note, David, because I'm, regular listeners will know I refer to the podcast on, that we try and give back to, we don't pay guests to come on our platform, and we don't, as of yet, take any sponsorship. So, so we try and, reward the people that are so generous like yourself with the time and expertise that they come on and share their stories, their businesses, their lives, with a little bit of a podcast on. So I would hate for you to leave today without giving you the opportunity to tell people how can they find out more. What have you got coming up that's going to, help take Victor fully functioning to the market and build these great collaborations with with people out there?
So I think the key thing is education. We've been, starting to, develop our social, marketing, as we approach the launch of Victor, which, yes, as I said just a moment ago, will be at the Emergency Services Show in Birmingham, the NEC, the 18th and 19th of September. And it would be
Registration
great.
is free. It's free, and there's a bar. There's a bar inside. I was like, these people know how to party. Like, sign me up, bro. I'm in. I'll have to drink after I do my PT test. Maybe we should have me drink, then do the PT test and see how it goes.
Great content. So we've got the emergency
That
services
sounds like a
show.
great idea. So coming and seeing us at events like this, and I think from commissioners, senior police officers, people who have an influence in terms of being able to engage in new innovations and looking at pilots, ambulance trusts, mental health trusts, within these bedded facilities, is to contact us, contact details, through our website, Victor Care. Victor, follow us on LinkedIn, share the information that goes out there. As I say, it's such a powerful platform now, but, in order for this to really, start to move forward, is, as I say, it's a case of education and awareness around Victor, what we stand for.
And you're now accepting pilot applications for anywhere in the England area, right? Like England.
Yes.
Okay. So anybody that wants to try and pilot Victor, sees a need, for their police departments or for their ambulance trucks, if they're working on retention and recruitment, if they're working towards, and I think that's really what the most impactful part about piloting has been. I've done some pilots with some of the largest healthcare institutions in the world in the past couple of years, and I think that's been the coolest journey for me, is being able to listen to the client, say, okay, Katie, here are your concerns about what's going on. Let's figure out how we can make Victor work for you and your department and your strategies right now. And then as we move forward, build on that vision and meet other metrics that we didn't even know maybe we needed to be measuring, or we didn't even know that would be impactful, or are there other ways that we can innovate and use collaborative approaches to meet the needs of this community response. And that's really what it is. It's about the community that we all serve collectively and we all live in, and I'll be there drinking in. So if people could have a resource for Melissa not to get in a fight at the bar, it would be great. So here we are.
And you mentioned a webinar.
Here for Mel.
Well, I mean, the team will be there, and we know they'll be.
David, I need the team.
Mel, you mentioned to me earlier that there was a webinar.
Yes. Oh, yes. So the webinar, and I think ad nauseum, I try not to be too promotional, because I think people really do listen to these podcasts to get actual clinical value and stuff from that.
No, we've got to get David and the team the podcast bump. I've got to be,
I'm
we
just
promised
saying,
our guests the podcast bump. Shameless promotion of our own stuff we should style it. But when we get when we get a rock star that comes onto this platform like David Boswell, I think we should let him sell the shirt off.
I am the rock star.
I'm just saying, it feels like I've become more American and you've become more British. Damn it, let's sell David Boswell and Victor on this podcast.
Well, you know what I like about Victor is I don't have to sell it, because it's a service that's so needed that it's not a sale to me, and I think, the webinar will be really interesting for people to hear a little bit more about conceptually what's deep in the weeds with Victor. If you heard this podcast, you're like, okay, my interests are peaked. The webinar is really that next step. How do we start? That's your opportunity to engage with us, ask questions. Of course, you can comment if you're on Spotify below, if you're listening to this there. But if you're on another platform, it's hard to engage back with us, right? So we wanted to give the opportunity where you could ask questions about design, about implementation, about where you think it would fit in. And then also for us to kind of understand the needs of our future customers. So I'm really excited about that webinar. It'll be August 28th. I think it's at 1:00 y'all's time. And it will be streaming live. And so if you don't make it, we'll be able to catch it on the replay. And then we'll have some materials that'll go along with the webinar. So when you sign up in the registration link, when the registration link closes, we'll be able to send you all the documents. We'll get a little bit of some information, and there'll be a little intro sheet that you can actually fill out some information to see if Victor is a good fit for you. And in that, we'll be able to, that'll kind of, when you come see us at the Emergency Services Show, we'll be able to have a more thorough conversation about how we can get started with you. So I hope everybody comes out to see us there. I'm excited to meet all of the people that have been listening and engaging from the UK. So I'm not going to wear my cowboy hat. So you'll just have to find me down amongst the I'm only 4'11", so yeah, I'm not gonna find you people. So you got to come over to the booth and find me, because I'm gonna be like this. Everyone over there is so tall. Not fair.
I'm speechless. Yep. That's it. I've emptied my notebook. I've got nothing else.
Thank you, David.
That was
You are
Thank you for having me. It's been great.
Bye, guys. Again, thank you guys for checking out Tactical Scrubs. Be sure to like, subscribe, and share. We will be launching a specific version of our stickers for the Emergency Services Show. So I will put a link to our Shopify store there. And also, I'm making David a t-shirt. So, you know.
Yeah. Can't wait. There we go.
Bye, guys. Thank you.
Thank you, David.